Hi, I'm Dr. Jane Levesque, and this is the Natural Fertility with Dr. Jane podcast, where we help couples uncover the real reason behind their fertility struggles. Today, I want to walk you through how we actually decide which tests are worth your money and which ones aren't, and why I do not recommend going out, ordering everything yourself, and then punching the numbers into AI or Dr. Google. I'm also going to walk you through a life example of a couple struggling to conceive for over 2 years now. They have been running their own functional lab tests and they have found it very overwhelming, and they actually have not gotten any closer in their fertility journey. Here's what I need you to know. A test is only as good as the interpreter. So which tests you need, when they should be done throughout your cycle, what the results mean, how they relate to the rest of the testing you have already been doing. These are all really important factors to consider. And if the interpreter is not thinking about these things, you're going to waste a lot of time, energy, and money. So here's what a new pattern that I have seen is evolving in the fertility space. You are frustrated with a conventional system, so you want to take matters into your own hands. I love that, and I agree that you should. But then you also get targeted for lab tests that can be done at home, and then the results are sent to you within 1 to 2 weeks. Also seems like a great idea. Then sometimes those lab companies will actually provide you with interpretation, or you can jump on a quick call with someone so then they can help you interpret it, and you're like, great, that seems awesome. I am not interpreting it myself. I have a professional that's going to show me what these numbers mean. And then maybe you even have a functional practitioner that doesn't specialize in fertility, but they'll tell you, if we optimize your health, we will optimize your fertility. And of course, there is some truth to that, but it's not the whole story. And so what I actually think has been created with all of these different labs that have become available is this false sense of reassurance. It's that these tests are going to provide you with the answers you have been looking for. And then there is this magical protocol that you're going to follow, and everything will be resolved. I want to save you a bunch of time today and a bunch of money, hopefully, and tell you what actually happens when we approach testing like that, which is, just doing one test at a time, or doing it for multiple different practitioners, not having anybody putting it together, and not really knowing if this is the right test that you need to do. You will get a bunch of results, okay? You will get a bunch of answers, but most of those results will mean nothing to you, and you will not know what you are looking at. AI will only tell you to focus on the things that is in the red and most concerning based on its own data points. So remember that AI has to be trained. In clinic, when I'm trying to evolve a protocol or change something, I put hundreds and hundreds of research papers into my AI bot to train it to think in a certain way. And most people, of course, are not doing that. And I'm also training it based on my clinical experience. Now, if you're getting advice from the lab itself, I do find that it's usually pointless, and I'm sorry to say that, but they only specialize in that one lab. For example, the vaginal microbiome or the gut microbiome. And they don't really know anything else about you. They can just give you context of what they're seeing. They're not doctors a lot of the times. Some of them are professionals, but a lot of them are not seeing patients on a regular basis. They're actually just researchers. And although there is a tremendous amount of benefit in research, there is a blend that we need to have as clinicians with research and actual practice with your patients to see if whatever is coming out in research, is that actually what's happening in practice? So I do find the advice is typically very fragmented and then only looking at one piece of the puzzle. Now, if you are working with a functional practitioner, but they do not specialize in fertility, you are often going to miss nuances that are specific to fertility. Now, I know this because before I started to specialize in fertility, I was a general naturopathic doctor. So for 4 years, I was a generalist, and I didn't know you were supposed to time certain tests with certain times of the cycle. For example, the vaginal microbiome or the gut microbiome should be done around ovulation when that estrogen is nice and high, which means the pathogens are coming out, so we're much more likely to catch something. I didn't know anything about methylation. I didn't run multiple panels at the same time because I was afraid to waste my patients' money, because I didn't know how to interpret them, and I didn't know how they fit into your fertility journey. Whereas now, and I'll go through what our bare minimums are, and the reason that we run those bare minimums as tests on all of our couples who struggle with fertility is because that provides us with clear answers to go to the next level in their health, in their fertility journey. And without those tests, we simply cannot get the couple moving quickly enough. And time is of an essence in the fertility space, period. I don't care if you're 25 or 45. Most people who are coming to us, they're not coming proactively. They're coming because they wanted to have a baby yesterday. And even if you are coming proactively, most people don't have a realistic timeline. Like they want to come proactively, prepare for 3 months and start trying to conceive. And if we find something like heavy metals, that's not going to take 3 months to get out of the system. So time is really important in the fertility space. And I think that component as a generalist, I never really understood because I wasn't in that space. Lastly, there's also interpreting the results that you see on the tests through the fertility lens. So there is a lot of nuances with endo, with PMOS, with fibroids, with autoimmune conditions, male factor infertility, that I just did not think about all those things because I wasn't immersed in it. And so shout out to all the functional practitioners. I think you guys are fantastic and we're doing God's work. But if you're not specializing in fertility and someone is coming to you with chronic fertility issues, chances are you're going to miss some things because you're not specializing in that field. And I'll tell you the nuances. For example, with an endo patient, I am looking for how she's metabolizing estrogen. I'm looking at how histamine is showing up in her body. I'm looking at her copper and zinc ratios. I'm looking at her cardiovascular and coagulation risks because I know that those are all important components of endometriosis. As a generalist, before I started to specialize in, I did not look for those things. I just said, we should have better gut function. We should have better nutrient levels. I didn't understand those nuances. And I think they're really, really important when we're starting to dig deeper. So the problem is you get a bunch of these results. You're probably going to get a bunch of conflicting advice. You won't actually know what's causing what. You won't know how to prioritize. And then you won't really understand what's actually connected to fertility. So here's how I want you to start thinking about functional lab tests. And a little sidetrack here. When I first started making content online in early 2020, so 6 years ago, I preached about getting more testing done. And this isn't my idea. I'm just talking, my mentors were teaching me that when you look at a test, you can see exactly what's going on, and then you can provide a personalized protocol, and that's what's going to move the needle for people. So test, don't guess. That's something that has been around in the functional world for a long time. Now I'm seeing these tests available all of the time, and I think fantastic. But the new problem we've created is that you as a patient are running these labs on your own, or you're running one lab at a time, or you have a practitioner in front of you that only specializes in reading the Dutch test for whatever reason and nothing else. That in the fertility space, that creates a lot of fragmented and conflicting advice because you cannot isolate anything in fertility. It's not just your uterus that's pregnant, it's your entire body. So you can't just look at how your hormones are being metabolized, and you can't just look at the gut or just at the vaginal microbiome or just at the nutrient panel. A lot of the times you need to look at all of those things, and I'll tell you how we prioritize because let's be honest, not everybody can afford to spend limitless amount of money on tests, but also we don't want to overwhelm the body. You don't need to run every test. This is where understanding the history is going to be really important. But here's how I want you to start thinking about testing now. Testing is still a super powerful tool. If you are taking supplements and you're making changes to your diet and lifestyle and you don't have any testing or data to support why you're doing what you're doing, you are actually just guessing. Okay, so when people ask me for advice, Dr. Jane, what supplements do you recommend for PMOS, or what's the best one for endometriosis? I don't know until I sit down with your history, I look at your symptoms, and I look at your labs, because otherwise it's just general advice, and you are guessing, essentially. And I know there's things that are really well researched. CoQ10. Everybody should be taking CoQ10, right? And it's like, right, yes, they should be, but can you absorb it? Are you taking the right form, the right dose for you? Is your liver functioning properly? What's happening in your gut? What about other nutrients? Are you able to convert it? I have so many questions to make sure that we give you the right form. And all of my patients are on CoQ10. But when I introduce it, really depends on each patient. And the dosage that I go in really depends on each patient. And these are the kind of nuances that can make or break your protocol. So you also do not need to run all of these tests, all the tests that are out there. But what you do need will depend on your history, your current symptoms, your goals, and your timeline. What I say to my patients, there's the iron triangle, there's the cost on one side, the results, and then the time. And you can only have 2 out of the 3. You can't have all 3. So if you need to move fast and you want good results, the cost is going to be higher. If you want good results, but you're okay that it's going to take a bit more time, this is where we can compromise the cost. So you get to decide, and it very much depends on your age, your situation, your symptoms, everything else that you have already done. But this is how we curate our protocols, and when we decide what do you want to do, how many tests do you want to run, do we actually need to run them all? Every test that you do run should fill in a piece of the puzzle, and it should change the direction of the treatment. If it won't change the treatment, we do not run the test. I think that's really, really important. Do not run the test unless it is changing the direction of your treatment. There's also a list of priorities when it comes for testing. So, for example, everyone in our clinic will get a stool analysis, that will get a comprehensive blood work. So women will get day 2 and 3, and then day 19 to 23, so 7 days post-ovulation. Males will get a really comprehensive blood work, and then methylation. And we are doing genetics as well as blood, because I find the genetics are super helpful for us to know, so we know how to support you long term. And then when our women do become pregnant, then we know where they're going to quote unquote struggle based on their genetic makeup. So I find that those are non-negotiables. They give us an insane amount of information, and we can move the needle quite a bit. But depending on your history, your symptoms, your goals, and your timeline, we might also recommend that you do a nutrient panel or a vaginal microbiome or a comprehensive urine analysis or a seminal microbiome. Some will need an environmental toxin panel to assess the molds, the heavy metals, the industrial toxins like BPAs and glyphosate. Some will need uterine microbiome assessed. We add certain tests based on your history, your symptoms, your goal, and your timeline. And I know you're like, oh, but my goal is to get pregnant and have a healthy baby and a healthy pregnancy, or my goal is just to get pregnant, or I want to get pregnant next year, I want to get pregnant in 3 months, we want to get super crystal clear to make sure we're on the same page, and then we support you as best we can. And we're always going to be super realistic about what we're seeing in the tests and what if the goal matches up to the timeline that we have laid out for ourselves. Once we have the results, there's also a list of priorities in terms of treatment. So this is something that gets really missed when you do not have one practitioner that's looking at all of these tests, or when you have multiple tests done at different times. So Dutch panel 2 years ago, and then a stool analysis 6 months after that, and then a methylation panel 6 months after that, and then I did blood work again 6 months later. So you have all of this fragmented information. You don't actually know if you've corrected some of those issues from the past. People are not rerunning their tests to see if they corrected it, or you're doing a vaginal microbiome panel. I know I see some of them on subscription now, where every 3 months you can just run one. That's not really, you shouldn't have to run one every 3 months all the time. But if I see that you have ureaplasma, I'm going to write out a protocol. And depending on what else came up, do we treat the ureaplasma first, or do we treat some other things and prepare the terrain to make sure that your body can actually clear it, and then we can retest in 6 months, or we can in 6 weeks, or we can retest in 12 weeks. This is where I don't like the subscription models, whether that comes for supplements, to be honest, or for labs, because for the most part, your body is going to be changing. There are some supplements, let's say ubiquinol or protein powders, that are really good that you could do on subscription models, but I am very much, you got to work and support the body as it's changing, and the body is constantly changing because your environment is changing and you're growing. And once we have the results, there's a list of priorities for treatment. This is really important. We need to make sure that your bowels are moving and your other channels of elimination are open. Drainage. Can you actually get rid of things? I can't tell you how many patients come to us and they're like, I haven't pooped in 5 days, but that's just how I am. That's not normal. That's severe constipation. You're absorbing all of those toxins. If you're eating every day, if you're eating multiple times a day, you should be pooping every day. You should be pooping multiple times a day. We also need to make sure that you have energy in the body to start clearing pathogens. So that's the mitochondrial function, and that's the methylation. We want to make sure those things are really, really supported. That's why we test those things almost non-negotiably. Now, we can't directly test mitochondrial function, but there is indirect markers through organic acids. You can look at methylation, you can look at inflammation load, antioxidant status that will kind of give us an idea of what's going on with the mitochondria. I do find that most people will need some kind of spike protein clearance now, post-COVID, whether you're vaccinated or not, and that's a story for another day. But, my husband had to get vaccinated. I did not, and we recently tested his spike proteins, and his were through the roof. Now, he has a couple of other components that attributed to that, like having hemochromatosis, and my spike proteins were not as high as his, but they were still tremendously high. So this idea that there is a transference between partners is very, very real, and we can actually see it on lab tests now. So I think it's really important to talk about that because it's a real thing and it's happening. I also find that most people need some kind of vascular support now. Again, post-COVID, the inflammation, the blood movement, the blood cleansing. We're seeing a lot of cardiovascular risk. The patients that I'm going to talk about today at 31 years old, his markers are that of a 50-year-old. We are seeing that more and more in practice, and it's quite alarming. And again, the reference ranges are shifting based on population's health. So this 31-year-old, when he got his results, he goes, well, that doesn't look that bad. And it's like, it doesn't technically on the reference ranges, but if you consider his age, you go, this is terrible for a 30-year-old. This is terrible. Like, this is not that bad for a 50-year-old who's had another 20 years wear and tear, if you will, on the cardiovascular system. But for a 30-year-old, it's not good. So context is really, really important. And last thing is we always need to address the pathogens, and we need to address them in the order of priority. You're not going to clear a viral infection before you clear a parasitic infection. The same with bacterial before a parasitic. So there's an order of importance, and if mold is a big component, or candida and yeast, we typically need to clear that with parasites at the same time. And there's usually not just a clear like, you have parasites in your stool. I find there's for sure some markers, like some tests we get back and we could see that. For most people, we're actually going to notice differences in their immune system, and what we're seeing on the lymphocyte breakdown in the inflammation levels and iron levels and nutrient levels that actually tells us, okay, there is a parasitic load, but there's also this yeast load, and we need to work with it together. But before, you can't just like go in and get the loudest pathogen. So if it's like ureaplasma or even BV, we have a lot of women with chronic BV. First of all, you need to treat the partner and you need to see what's going on with him. He can be a silent carrier, but sometimes the loudest pathogen is not the one that we need to clear first. And this is why running all of the tests, laying it out, and then prioritizing it based on what we're seeing, how much energy the body has, the drainage capacity, the inflammation levels. We need to understand the terrain and everything else that's going on in the system before we just start hammering and killing. I do think, a parasite cleanse or a candida cleanse sounds sexy, and there's a lot of people who are doing those, but we tend to see patients who have done those and nothing happened, or they did those and things actually got worse. Because when you don't know what you're dealing with, you can create a big mess, and you can, cause more damage than good. And I just say this because every day we have couples who come to us after doing these things on their own, feeling worse than they did before when they started, and they spend the money and the time and the energy on all of these different protocols and all of these labs. So I'm just going to give you a really quick overview in terms of what we found. This couple, they were struggling for 2 years. He's 31, she's 41, a lot of inflammation. They've been running the functional panel. I think it's like 300 markers for $100, and you can run them every couple times a year. And don't get me wrong, I think like it's great. People can run these labs. The problem is no one is interpreting these labs. So running the lab without interpretation and without a plan after it is like, honestly, it's pointless. Even if you're getting something like an Oura ring, if you do not understand the information that you're reading, or you never actually go to start tracking your information or changing your behavior, what was the point of getting that device? So I rather see you spend that time, energy, and money finding a practitioner then running labs and seeing some reds come up and not really knowing what they mean. And like I said, going down Dr. Google. Or worse, so for him, he had a really bad cholesterol picture for a 31-year-old, where his good cholesterol is really, really low, his triglycerides. So the range is, we wanted below 150, and he is 152. And he's like, that's not that bad. He should be under 100 and closer to 50 for a 31-year-old. So on their own, triglycerides, like, it's not that bad. LDL is at 121. Again, not that bad. It should be below 100. And I'm like, why is his cholesterol elevated? When it's not usually just diet, it's actually liver function and mitochondria function that allows us to use that cholesterol and make it into hormones like testosterone or steroid, like any steroid hormones, right? We use cholesterol to do that. So he had homocysteine that was quite elevated, which is a big risk for cardiovascular inflammation. Now, that cholesterol with higher homocysteine, those are two markers that are screaming cardiovascular inflammation. And then, his blood sugar was at 5.6, his hemoglobin, his AST and ALT, which were liver enzymes. His ALT was almost 2-to-1 ratio to AST, which is a huge sign of liver stress. And also it's on the upper range. So his liver is inflamed, which is why his cholesterol is elevated and his blood sugar is dysregulated. So he's inflamed. He's not making hormones very well. And he's definitely not going to make sperm very well. We keep scrolling. His GGT, which is a liver enzyme, is 119. The range says 3 to 90. Ideally, it's in the teens, okay? So ideally, I want this below 20. He is at 119, so he's 6x what's ideal. And this is a very, very inflamed liver, especially for a 31-year-old. Now, this is someone who drinks occasionally. He's not an alcoholic by any means, but it just goes to show you that his liver is already under so much stress. To add alcohol to that is just adding fuel to the fire. Then, his red blood cell count, there's some anemia picture presenting. The iron is not quite where it should be. So now I'm thinking, is this a parasitic load? Is this just really high inflammation? What's going on with blood sugar? His insulin is at 19.2, which, like fasted, it should be below 10. His estradiol is high and his PSA percentage free is low, which tells me his prostate is inflamed. So 31, if you go to your general practitioner, they will never test your PSA unless you're over 50. They just will not. They're like, no, there's no men that are inflamed with their prostates. We test it all the time because prostate function is really important for seminal fluid. And it's like 20% of the seminal fluid. It gives energy to the sperm to swim. We catch inflamed prostates all the time. And so this is that nuance I'm talking about as a generalist versus as a fertility specialist. As a generalist, I had no idea that the prostate contributed to 20% to seminal fluid and that even a 30-year-old should have their PSA markers ran. I'm not saying they need a prostate exam, but they should have their PSA markers ran, and then potentially we rerun it once we calm down the inflammation. If it's still low or if it's still alarming, then we're going to get the prostate assessed even further. Or sometimes men need testicular ultrasounds. If we run proper lab tests, we will catch so many more things. So his cholesterol was just out of whack. The blood sugar, the hormones, his vitamin D level was, below, it was like 25 or 22 is very low. So when someone tells me no, the sperm was fine, it was not fine. There's no way it's fine with this blood work. It's maybe okay, but there's no way it's fine. So there's a lot of inflammation. Then when we run the stool analysis and the methylation panel, and they also did a nutrient panel, but the carbohydrate metabolism is they're just not metabolizing, both of them. They're not metabolizing anything. It's just all sitting and fermenting. There's a huge microbial imbalance. There's basically no beneficial bacteria. He has really poor estrogen detox through the gut. His SAHI, which is a cardiovascular risk factor, is really elevated, and so is his homocysteine. So for a 31-year-old, when I see those numbers, that's a heart attack in 10 years. So when we have heart attacks at 50, 60, 70, that's okay. But, 40-year-olds, and then now we're going to start having it into the 30s. So when I'm talking about spike protein clearance and some kind of blood vessel vasculature support, this is what I mean. This is what we're seeing in practice and day to day. He had a lot of amino acids that were low. She was older, so of course this is where they're feeling the time pressure, but her CRP was over 7, and ideally it's below 1. So she's very inflamed. Her iron is low. Her liver enzymes are also elevated. She has thyroid antibodies. Her ANA was positive. Vitamin D was low. When you look at her blood work just through that panel, it just looks like it's a couple of things that are off. It's not that big of a deal. But in the fertility space, having that high level of inflammation, having low iron, high liver enzymes, the thyroid antibodies, the ANA, all of those things are either screaming recurrent pregnancy loss, they're screaming just like lack of being able to get pregnant. And even if you do get pregnant, the risk of preeclampsia, gestational diabetes is so high because she's already so inflamed. So again, our goal as a clinic is not just to help you get pregnant. We want to see a healthy pregnancy and a healthy baby. And these are just like basic markers that we need to look at. They saw those markers, they just didn't do anything about them because nobody told them what to do about it. So that's what I'm trying to save you from. Don't just run tests. They still like, oh, but it's only a couple $100, but you still put that time, energy, and money thinking that you're putting time, energy, and money getting further into your fertility journey, and you actually are not. So that's the false reassurance that I'm talking about. Her gut, terrible digestion, both protein and carbs. She had pathogenic bacteria. There was a certain pathogenic bacteria that was over 27%, just one, let alone some of the other ones. So 30% of her gut is just really crappy bacteria. No wonder she feels bloated. No wonder her immune system is elevated and her autoimmune markers are off. No wonder she's so inflamed. And then her Sahi was elevated. Her detox was so backed up. All her amino acids, the copper and zinc ratio is off. So again, when I look at someone like that, they've already spent time, energy, and money into labs, but they didn't do anything with that information because they didn't know what to do. So my hope is that we save you from kind of spending these random hundreds of dollars here and there and actually make a concrete plan and focus on finding the right practitioners instead of what is the sexy new test that's going to come your way. Because we as practitioners always get targeted with labs as well. You should run this test. And what we do as a clinic is we run the test on ourselves so then we can see, is this test actually worth it? And does it provide us with the information that we're looking at, that we're looking for? How is this going to change our treatment plan? If it doesn't change my treatment plan or it creates more confusion, we do not run the test. So there's some vaginal microbiomes out there that will show you a positive or a negative on BV. That's not helpful. How positive? Which bacteria are overgrowing? You know, I have some patients with BV where they have 900 times the amount of the Gardnerella that they should, and some that have 1.5 times more than they should. That's a very different protocol. And usually then if I look at the gut, I can see, well, is this the vaginal infection and imbalance that's the issue, or is this a gut issue? And it's different for everyone. So my hope is that it helps you save some money in this kind of hamster wheel energy. That's the worst, is when we get patients who are like, I just been on the hamster wheel for so long, I don't want to waste any more money. How do I know you're actually going to help me? My hope is that you stop the hamster wheel and you spend all your time, energy, and money finding the right practitioners. And if this sounds like exactly what you're looking for, then go ahead and fill out the application down below and we will review it and let you know if we can help, and we'll show you what those next steps are. And if we're not, then my hope is that you find a practitioner that you really align with and you understand what's going on in your body, and you don't run any test unless you know you're going to do something about it. And if you do something about it, you retest. And if you retest and nothing has changed, then we either need to find another practitioner or we need to change course of treatment. Your test should always be changing when you're implementing the protocol. I've had patients who had a Dutch test and they would just redo them every 6 months. And it was just the same Dutch test every 6 months for like 3 years. I'm like, why did you do this? This isn't helpful, And I think that's the subscription model that I want you guys to not subscribe to, because it literally just wastes a lot of time, energy, and money, because you are putting energy in. It's just not getting you anywhere. And this is why I recommend having some kind of tracking device, because really what we want to know is that you're moving in the right direction. And you don't have to retest a big blood panel or the Dutch or the stool analysis to know that you're moving in the right direction. You will well. But typically, if you're tracking something like your sleep or your HRV, you can see if the body is moving forward or not. And even things like your weight. So let's say you have a bunch of extra weight to lose. If you're losing weight, you're moving in the right direction. If your energy is moving up, good. If you're pooping regularly now, great. If your skin is glowing, if people are noticing something about you is changing, those are all really good signs. So I hope you guys found this helpful. Thank you so much for being here. Like I said, if you want to fill out an application, please do so in the link down below and we'll get back to you. Otherwise, I appreciate you. Thank you for tuning in and we'll see you soon.